make this work. Hold on. It worked. I got it. It worked. I'm dying here. Holy crap. All right. Holy crap. It worked. Okay. I'm hoping I am still live on Instagram. Let's make sure. Ah, did I mess it up? Hello. Can you guys hear me okay? Oh, Rosa. She's having contractions right now. I don't think I'm live. Oh, hello. Let me see if I can get it to go live again. Okay, can you guys see me on Instagram? Because now I don't know if it's actually working. I'm so mad. Ah! I am trying to make sure if it's going live. Does anybody see me on Instagram? I'm trying to fix this, so bear with me for a second. I can't believe this. I'm gonna make it work. If it kills me, hold on. How are you guys? It says it's streaming. Let me see if Taylor can see me on Instagram. All right, let's see. It says it's working. Can anybody tell me if I am live on Instagram? I am? Oh my gosh, it's working. You guys, I am getting better with technical stuff. Rosa. Okay, Rosa. We are going to help you work through those contractions. Do you remember what we learned the other night? Because Rosa, you are incredible. Incredible. Do you want to go live with you're on YouTube. Darn it. Okay, Rosa, I want you to take a nice deep cleansing breath. So you're going to take a nice deep breath in, take it in and get air down to your baby. Take it in for 4. Ready? In, 2, 3, 4. Take it out. 2, 3, 4, 5, 6. Remember, you've got this. You are so incredibly powerful. Okay, Rosa, what I want you to do is to tell me how far apart are your contractions? No, Anna, I can't see it on Instagram. I'm trying to figure out how to see the comments on Instagram. I'm going to let Taylor, let me see if I can, I don't know what I did with the Instagram live video. I'm trying to go on there. I can't see it. Darn it. Let's see if I can go to it from my daughters. If I can get to it from my daughters, then guess what? Yes, I can.
Let's see if
I can. I just need to turn it down so I can see it. Now I can see your questions on Instagram too. But let's help Rosa because I've got Rosa 2 to 3 minutes apart. What number baby, Rosa? So for those of you guys watching on Instagram, I am also live in the Fearless Birth group and on YouTube because this girl is getting better with tech. So if you have any questions, I am looking at all the platforms, but for some reason, Instagram does not look up. Okay, so Rosa, how long have your contractions been 2 to 3 minutes apart? Has it been longer than an hour? Hi, Leanne. So what we're going to do is I'm going to take your questions, especially if you have any questions about the birth classes. I wanted to hop on because you guys only have it's Wednesday. So almost 3 days left for the classes to hop into the classes for $100 off. You guys can't beat that. So I wanted to come in, answer any of your questions about taking a labor nurse mama birth class or our virtual labor support, which you're getting live and in person right now with Miss Rosa, who is having her first baby 2 to 3 minutes apart for an hour. So any of my students on here, does anybody know what my advice to Rosa, first time mom, contractions are lasting 2 to 3 minutes apart for 1 hour? How much longer do I want her to labor at home? You're having a quiz, a pop quiz. Does anybody know how long I want her to labor at home before I want her to head to the hospital? Anybody have an idea? Let's see if my mama's on Instagram. No. Yes, 1 more hour. So Rosa, yes, 1 hour. That's my students. Yes, exactly. You guys are so smart. 422. No, yes, 412. So less than 4 minutes apart, each contraction lasting for 1 minute or up to at least 1 minute for 2 hours. And the reason you want to do that is because that will mean that when you get to the hospital, you're going to be in active labor. Now, here is a big tip for you. You also want to listen to your instinct. So if your instinct is saying, I really need to get to the hospital, then you want to go to the hospital, but not fear. I don't want you listening to fear. So you definitely don't want to go to the hospital because you're afraid. You want to go to the hospital because your instinct is saying. So Rosa, I want you to take nice deep breaths when those contractions are coming. Take a nice deep cleansing breath and then take slow in, count to 4, and then breathe out, count to 6. When you're having the strongest part of your contraction, I want you to moan, a nice deep moan. Okay, let me see. Yeah, and it depends on how far away the hospital is, not the office. You don't want to be going to the office right now. That'd be a bad plan. So if you're now I said office, if your hospital is, 30, 45 minutes away, then maybe wait another 30 minutes and head to the hospital. But yes, we know you're having some contractions right now. All right, let's see. Someone asked a question. My blood pressure spiked yesterday, but came back down. I'm almost 36 weeks. Should I be concerned? And it was 147.98 this morning or yesterday. And today it was 117.64. So that is a hard question to answer because I don't know the rest of your history. To have just one random high blood pressure, no, I would not be concerned. But let's talk about what's going on. Would was this stress induced? Did you just get to the doctor's office, you're sweating, you rushed, you were fighting with your partner on the way, or maybe your mom was annoying you, or your other kids were driving you crazy. You get to the doctor's office, you rush into the office, it's hot outside, you're sweaty, you didn't eat, you rush in and you're late to the appointment, they rush you back, they're being rude to you, and you finally, you throw your bags down, you sit down and they check your blood pressure and it's high. As opposed to you're chill, you get in there, everything's good, and it's high. Do you see the difference? Or your blood pressure's always been perfect and you have this one high and then it's always perfect. However, let's say you start going to the doctor's office and they're steadily creeping up and you're not having good ones in between. So we really need a bigger picture, but just one random one, I would not be concerned. If you have this one and your labs start showing some issues, you have this one and your labs don't start showing issues, so you definitely need a bigger picture. Let me see if I missed some. I'm in 9th pregnant, entered in 9th month, and both foots are swollen. Please reply me. So It's common to have swelling in your 9th month of pregnancy. Now, if it suddenly becomes swollen or one foot becomes swollen and the other one, that's a little different, but it is very common to be swollen during pregnancy. What we recommend is that you increase your fluids, decrease sodium. When I mean sodium, I don't mean just adding salt to your food. Talk about like packaged foods, foods that have added sodium, added salts to them. Think of like potato chips or salty snacks. You don't want to have those. 40 weeks tomorrow, I'm thinking of a membrane sweep. First baby, what are your thoughts on membrane sweeps? I'm actually a fan of membrane sweep, which is funny because I'm not a fan of cervical exams during pregnancy. However, once you hit 40 weeks and you are die-hard, want to wait for spontaneous labor, you're strong in your convictions, you're not going to be swayed, and it's not going to get in your head if you don't hear what you think you want to hear. What I mean is, if you're going to go to the doctor's office, let's say, I don't know your name, maybe Larissa. So Larissa, let's say you go to the doctor's office and you're not dilated, so you can't get a membrane sweep. I want you to walk through that scenario. How are you going to feel? Are you going to feel, negative? Are you going to feel worried or stressed? Are you going to start not trusting your body? I want you to walk through that scenario and come up with a plan, because what I want you to remember is it's okay. It's all right if you're not dilated. It's okay if your cervix is not open and you can't get a membrane sweep. It doesn't matter. Cervical exams do not matter. Your cervix does not matter until labor starts, and that can change on a dime. So if you know that it's not going to stress you out, it's not going to get in your head and trip you up, then do it. That's my only concern, is it might get in your head. All right. If I missed your question on Instagram, we had a little bit of technical difficulties, so drop it again so I can see it. Oh, first semester for nursing. So excited. I love it. I think I got your question. Let's see if I missed some down here, and then I'm going to go over here. How likely will placenta previa resolve? It depends on where you are in your pregnancy, but usually most of them do move up and resolve. I have a video on TikTok about that. So if you ever want to see more teaching style videos, I do those on TikTok. TikTok likes them better. Kind of like a talking head, just me teaching, where Instagram likes them to be a little more entertaining. All right, let's see if I got how we've got that. Let me go over here. Rosa is having a home birth. I love it. Victoria. So Victoria is asking about a membrane sweep with GBS positive. So some providers will do a membrane sweep if you're GBS positive, and some won't. There's no rhyme or reason. Some will, some won't. No matter what, they should be using a sterile glove. It should be a sterile procedure, and they should be cautious. So let's see, 36 weeks with twins, wanting an unmedicated birth. Have you experienced this with patients? Yes, I have. And you absolutely can. You can have one for sure. Definitely need to be educated, definitely need to have a filled labor tool bag, and have a plan. Best way to help pain in top rib area and back pain where the bra line is. So the best thing that I could recommend to you is to see a Webster certified chiropractor and to do some like prenatal yoga. I love Deb. She is the prenatal yoga instructor that we recommend. We have some of her workshops in our membership. We have recordings that our girls have access to that are phenomenal. And we recommend seeing a physical therapist if you can. You definitely want to make sure one of the classes, if you guys join our signature birth classes right now, which are normally $297, you can use Birth Queen to get $100 off. Not only you're going to get our birth classes, you're going to get 3 other classes for free, including our purposeful positioning. And the reason I'm saying that is It's very important to use proper positioning when you're pregnant, because that can make all the difference in the world as to how you carry your uterus and how your uterus carries your baby and how your baby gets positioned into the pelvis. So we teach you a lot of that inside of it. Hi, Elizabeth. How are you? Hi, Amy. Amy is high risk for preeclampsia, high BP and glucose issues, including frequent hypoglycemia. Ugh, I know that feeling. More likely in physical exertion. Doc and I are determined to get as close to 40 weeks in natural delivery as possible. Do you have any favorite positions for labor and delivery that don't increase risk? So I love side lying and I love tug of war. So I think those would be great. I think you're talking about pushing. I love those for pushing. As far as laboring, with preeclampsia, one of our biggest concerns during labor is decreasing stress. So a lot of times my preeclampsia mamas are going to be tend to be a little more on the bed rest side. So we have to get very creative with your bed rest positioning. So we're going to use a lot of peanut ball positions, and our purposeful positioning class has tons of those in there. When the peanut ball came onto the scene, you guys, we as labor and delivery nurses were so excited because we used to use your bedside table. I wish I had pictures of what we used to do with the bedside table. It was legit hysterical. Some of my patients probably remember that. Yes, the peanut ball is magical. Let's see, feeling the baby kicking in her belly right now. That's good. I love it, Rosa. And I love that you're having a home birth. I think that's wonderful. Let's see if I have any more questions over here on Instagram. Let's see. Oh, so you found out at 19 weeks. So Hope, I would say that, I think your name's Hope. Your username is, I would say it'll probably resolve itself. 36 weeks with twins. We did that one. Let's see if we have another question over here. Is breastfeeding babies have constipation? It's very common. Increase your fluid intake. And what I used to do is I personally would eat foods that will help move their bowels. Like I would eat prunes myself, and it would do the trick for me and them. You can always consult your lactation consultant as well. We have started working with a new breastfeeding course that I love, and I'm going to be chatting about that next week. We are so excited. I just went through, me and one of my students went through their courses, and they're amazing. 8 months pregnant with my second baby, feeling lots of pressure, low in my pelvis, very, very common with the more babies that you have, Ashley. Should I be concerned about delivering early? Probably not. If you think about it, your pelvic floor, your uterus, all of it has done it all before. So it's not as, tight and effective as it was with the first baby. So it's going to sit a little bit lower. Rosa. Okay, so we are having live birth with Rosa right now. Her water broke and she is having a home birth. So we are hopping along. So how do we access the course package discount again? I can actually, let me see if I can put it up for you. Let me fix it real quick and I can do it. And all you need to do is put in the code Birth Queen, all in caps, I think. I could be wrong. You should be able to see it right there. And you can just take a screenshot of the, I don't know if you can see it on Instagram, maybe, I don't know, but you should be able to see it on YouTube and Facebook. And you can take a picture of the screen and you should be able to see it right there. Not sure, hopefully, I don't know. You guys know I'm technically challenged. I'm trying to get better on this. Who knows? One of these days. Not sure. Anyway, But if you go to labornursemama.com, pick classes, and then depending if you are a first-time mom or a fifth-time mom who has never had a cesarean, then you're going to want to pick Calm Labor Confident Birth. That's for home birth, hospital birth, birth center, doesn't matter. One baby, twins, 4 babies. That's for everyone. The VBAC lab is specifically for a mom who's had a cesarean who wants to have a vaginal delivery. Either birth course, you can use the code BirthQueen, and you're going to get 4 amazing bonuses on top of $100 off. You're going to get my birth coach class, which is going to teach your coach exactly how to take care of you and to support you through each stage of labor and postpartum. And this is so important because when you're in labor, you do not need to have to come up with what someone can do to help you. Because if you're like me and you're in pain or you're stressed or you're overwhelmed, you don't know what to tell somebody to do to help you. So if your partner or your coach or your mom or whoever's in the room with you is like, what can I do? You're going to be like, I don't know what to tell you. But I know what to tell them from 16 years of experience and 6 babies myself, and all unmedicated. So I know exactly what to tell them. I've seen way too many people in my mama's rooms sitting on the couch, and not because they don't want to help, they just don't know what to do. It doesn't come natural to people on how to comfort someone in labor. So this class just lays it all down, breaks it down, because when you're in labor, your only job is to labor and deliver. Their job is to support you all the way along the way. I don't want them on their phone, texting their friends, doing work on the side or the sly, or posting on Instagram. I want them serving you, taking care of you, and helping you achieve your goals, whatever they are, having baby. Then you also get our postpartum recovery class, which is like from A to Z, how to prep your body, how to get ready, how to prepare your home, all the things you need to do to get ready for your mental health path, for your physical path, for your emotional path, your support community, which is us, and how to recover properly so that you don't lose your everlasting mind. And then we also throw in our purposeful positioning class, which is our power punch. We're going to show you how to move your body throughout pregnancy, some exercises to prepare your body, our top tips, and then all my favorite laboring positions, not just pushing, but laboring, how to move your body, how to work your pelvis, how to open the inlet, how to open the outlet, how to move baby down and out, how to push medicated, unmedicated positions, no matter which way you go. And then the last bonus that you get, but is so powerful, is 30 days in Calm Mama Society, which is something that we offer that no one else offers, which is our virtual labor support, where you're going to have access to me, a labor and delivery nurse, childbirth educator, and 2 doulas. And the reason we do this is because we believe that if we can come alongside you and walk this journey with you intimately and in relationship, that we are going to change the birth culture, because it takes the knowledge, but it also takes the ability to use it. And we know that you learn all the things and then you are like, what do I do with it? So we come alongside you, and we know a lot of you guys cannot afford a doula. And so we give you 3, a labor nurse, 2 doulas. So you have 3 doulas basically. And we provide inside of our membership, it's 30 days free, and then it's $19.97 a month. You get 3 virtual labor support people, weekly workshops, weekly hangouts with the team where we come alongside you. In fact, if you join today, tonight is our pregnancy hangout. Tomorrow night is our postpartum hangout. And we have a powerful community. We have our own app. We go live inside of our community. We do weekly workshops. Last night we had a baby sign language class. We have classes on sex and relationships and mindset and birth and postpartum, feeding baby, tongue ties, everything you can think of. Anything my girls ask for, we try to get inside of our workshop. And all of those recordings are in there. So as soon as you join, you have access to them. And it's $19.97 a month after your 30 days. And you have actual access to a labor nurse with 16 years of experience, 6 babies, and then my 2 doulas, one of whom is a twin mommy, one of whom is pregnant with her second baby, and so much experience, and then over 1,000 moms inside of our membership. So you get all of that right now for $100 off until Friday at midnight. So you really have nothing to lose. And we have a 30-day money-back guarantee. So it's like, you can't beat it. Plus, we have a couple options. You can pay $197, or you can use PayPal credit and pay 6 payments of 30 something, or you can use your HSA or your FSA to pay for it. So did you guys know that your insurance, a lot of insurance will pay for birth classes? It blows my mind. And the reason they do that is because they know if you guys take a birth class, you're going to cost your insurance company significantly less, because a mom who is educated is more likely to have an uneventful vaginal delivery. She's less likely to go to the operating room. She's less likely to use more interventions, less likely to have an episiotomy, less likely to use more pain meds, and more likely to love her experience. It's a win-win. I went off on a tangent, y'all, but you can take a screenshot of the screen right now, and you can join the birth class when we're done, or you can take a picture right now and join and come back to the live and say, I joined. And if you're past 37 weeks, right now, once you join and you're inside the membership, go and watch the onboarding videos. It's called Start Now or Start Here or something like that. Go to the one that says labor bat signal. I want you to start your labor bat signal, turn your light on, and you're going to have a private DM with me, Taylor, and Lene. Those are my doulas. And if we've got like 40 mamas going right now, we've got a couple in labor right now, and you will have access to us. And through your labor, through your delivery, you're going to be able to ask a labor nurse and 2 doulas, hey, the nurse just told me that the baby is stuck at 0 station. What do I do? And we're going to give you our years of experience, tell you what position to do. If your doctor's pissing you off and wanting to break your water and you don't know if you should, 3 of us are going to pipe in and say, hey, ask him this, try this, do this. And we're going to give you our best advice. And then you get to make the decision that you want with so much information. Anyway, that's that. All right. 8 months pregnant with my second baby. We already talked about that. Let me look. Most effective pain management tool for labor. The most effective pain management tool for labor. Let's see if any of my girls, any of my L&M mamas are on here, either on here or on here. What would you guys say is your greatest tool to handle the pain of labor? Someone tell me. I'm going to come back. Yay, Caitlin, I'm so glad you joined too. I can't wait. We've had hundreds of mamas join this week. I can't wait to meet all of you guys. Lene is leading. Yes, that's right, Tani. And I saw that you joined too. I'm so excited to get to know you. Mindset. Your mindset is your most effective tool. Presley, if there is one thing you can take away from me, birth is 90% mental. Now, I am not an athlete. I'll just say that. My husband is very, like, he works out all the time, but he is like my mindset coach, my go-to mindset coach. Sometimes I just want to tune him out because I know he's right, but mindset is everything. Everything. Oh, Jessica's on here. She just had her baby. She missed my birthday by a snare, and I'm a little salty about that, but that's okay. Anyway, your mind is everything. What you tell yourself, Presley, matters. So if you can if you are full of knowledge, knowledge is power, and you have your mindset in the right place, that is going to be your most powerful tool you can bring into your labor room. Because if your mind is calm and steady, then you'll be able to pull out the pain coping tool that you need at that moment. Because if you start losing it up here, then you're not going to know. You won't know, like, okay, I took my class. I know what stage of labor I'm in, but what works for this? I've got pain in my hips. What did I learn is good for that? Because if you start losing it, you're good for nothing. You won't know what to do and when to do it. But if you can stay calm and collective and you don't lose control, then all the other things you learned will come into play. Does that make sense? Let me see if that made sense to you, Presley. Give me an answer. I'm scrolling down to the bottom. Give me a thumbs up or a thumbs down if that made sense. Positive affirmations and believe in your body. That's right. Your mindset is everything. If you can remember throughout your birth that you are powerful and that your body was made to do that, nothing will trip you up. Nothing. Not the negative in-laws or your negative mother or, a doctor who's not believing in you and putting you on a time crunch. Nothing will trip you up. Not a turn in your birth path. Everybody wants to tell you that birth is so unpredictable and why plan? Yes, birth is unpredictable, but who cares? If you are knowledgeable, if you've taken a powerful birth class and you have a solid mindset, when things change in birth, guess what? You turn, you go because you know what you're doing. Let me see. I missed a question. Baby hears Trish's voice and now she wants to go haywire in her belly. That's right. My girls, those babies know my voice because I hang out with them all the time. Let's see if I missed a question. So I've got some guys. Let me shut my office door. I've got these guys here fixing. We had a leak in our roof and I've got these guys. They're probably out there going, what is happening in there? Hold on. I love it when I'm doing birth stuff. These guys are probably thinking I'm crazy. Anyway, let's see if I have any more questions. So for my new students, you guys, make sure you come to the pregnancy hangout tonight. And if you guys just joined today, tonight, 6 to 7 p.m., probably a little later, is a pregnancy hangout. And then for the rest of you guys, tonight at, I think, 7:30, I'm going live again with a birth story. I'm going to have one of my students, Sabrina, she's going to share her birth story tonight. Super excited. Are you guys like me? I love watching birth stories, listening to birth stories. I could just eat them up. Okay, let's see. Any advice for my sister that is having twins? She is so scared. Yes, Sarah. I would love to invite her into our community. One of my doulas is a twin mommy. We just had twins last week in our community. We have a lot of twin moms. Then she needs to do what everyone else is doing. She needs to take a birth class. She needs to work on her mindset. She needs to release her fear. So what I do is we take them out and we replace them. So she has to walk through each fear and acknowledge it. I mean, she has these fears. Acknowledge the fear, replace it with truth, and work on her mindset. She needs to practice visualization. She needs to practice breathing exercises and relaxation techniques. What if we hit that 24-hour mark after water breaks? How likely is a C-section to happen? So it's more than just the 24 hours. So this is another reason that you guys need to be educated, because they can't just say, boom, 24 hours. There needs to be other things going on. Is there signs of infection? If there are you responding to treatment? Do you have a fever? Is the baby having any tachycardia? So there's other things. Where are you in your dilation? Like, let's say it's been 24 hours and you are only 1 centimeter. That's a little more bleak. So there's a lot more to it. That, again, this is why education is so important. Let me see if I have any more questions over here. Hi from Greece. That is on my bucket list. All right, let's see what we have. over here. Is it normal to have lower back pain right now? Yes, Rosa, it is. So one of my favorite laboring positions, Rosa, if you guys are just joining, Rosa is in labor right now. And she is a first-time mom. Her contractions are about 2 to 3 minutes apart for the last hour and a half. So one of my favorite laboring positions is to sit backwards on the toilet or to sit on a birthing ball in a wide squat. Someone said mine is Friday. I wonder if that's a due date. So exciting. Let's see. Any tips for continuous monitoring? Want a VBAC and I know my provider won't let me without monitoring. I want to be able to move. We don't have wireless. So Audrey, if you're one of my students, what I would tell you is to go to the bathroom a lot. So I always teach my patients how to unplug and plug in the monitor. And if you need to go to the bathroom a lot, I mean, you need to go to the bathroom a lot. So if you need to take yourself off the monitor to go walk to the bathroom and sit on the toilet a lot, then you need to be in there a lot. So that is your prerogative, if you get my drift. So that's a workaround. A lot of my VBAC students, we push for intermittent monitoring. So I would have a long conversation with your provider. If baby's doing good and you're doing good, there really is no reason that you can't have intermittent monitoring. And if they're diehard, then I would suddenly have a very overactive bladder. All right, let's see. I've seen some suggestions to tell your provider not to massage or stretch your perineum during pushing to prevent tearing, but I feel like massaging would help. So I do not recommend a perineal massage during pushing. And the reason is because your perineum is very friable and it has a lot of blood vessels. Prior to pushing, prior to labor, totally fine. During labor, it's okay if they put some pressure on your perineum, but not massaging. By massaging and stretching, it could cause worse tearing. So I would not recommend it. A lot of them want to do this and pulling, and I would not recommend it. They can lube it up with some coconut oil or some olive oil, but not stretchy pulley. Hi there, 35 weeks and baby is transverse. Is there enough time for her to flip head down before 40 weeks? Hell yeah. Doctors worrying me about a C-section talk. No, I would go to a Webster certified chiropractor. And when we get done, let me write myself a note. I'm going to link some information for you, okay? I'm writing a note because you guys all know I'll forget. There you go. I wrote a note for you, Hannah, and I will try to remember. If I don't, send me a DM. Warm compresses. Yes, I'm totally a fan of compression, but not stretching. All right. Let's see. You're welcome. Okay, we got to the bottom over there. Let's see over here. And then I'm going to get off of here soon. For those of you guys who have not joined the birth classes, you better hurry. This discount is going soon. Our next sale will be in July. I think the end of July. So now's the time. And don't forget, you can choose. You have some different options. Hey, Trish, were you able to put the captions for the course? Oh my goodness, I got to make myself a note. What were the languages that you wanted? I know you wanted, there was a specific language. I'm writing a note. I am a note writer. Someone let me know. Due in November. Oh, so exciting. I love fall and winter babies. I think the little tiny sweaters and sweatshirts are the cutest. French or Spanish. Okay. Yes, I'm going to. When are you due? Remind me when you're due. Did you already join the birth classes? I'm going to work on Spanish first because I had someone else ask me that as well. Voluminous cord here, 38 weeks tomorrow. Anything I need to know? So, Kristen, I have had so many patients and I have not seen anything. I think you're going to have a beautiful delivery and I think you're going to be A-okay. I would not worry. Let me see when she said in August. Okay. How accurate are the sneak peek tests or results at a boy? So far, I think they're pretty darn accurate, but do not come back and haunt me. Ladies, take it from me, a mama that's 38, almost 39 weeks. It is worth the money. These classes have already helped me so stinking much. Thank you so much. Thank you. Thank you. I appreciate it. We love our students and we really feel like it is well worth the money. And we give you a 30-day money back guarantee. We haven't had to do that much. The only time we've had to do a few of them is we've had a few, not so great situations where we've had moms who have lost, like maybe they just found out they're pregnant and they've had a miscarriage, but we haven't had to use too many of our money back guarantees. 40 weeks, I want to go naturally without being induced. Please help. How can I go without an induction? I'm 3.5 centimeters dilated. Rhea, you need to join our birth classes. Go right now. It's on the board. Join and then get in the labor bat signal. You do not need to be induced. You're 40 weeks, you're 3.5 centimeters. We can get you in labor this weekend. Do not let them induce you. That is asinine. Oh my gosh. Do not. Now, for those of you guys as well, there's always the option of joining just the membership. And that's labornursemama.com/C as in cat, M as in mama, S as in Sam, CMS, or Calm Mama Society. But I would not be induced. Now, if you join just the membership and not the classes, you do not get the labor bat signal. And the reason we do that is because we 100% believe you have to have a birth class. You have to take our birth classes because when we're giving you your virtual doula support, we refer to the education. So you have to have had our birth classes. And in fact, my doulas who do in-person doula support have their doula clients also take my birth classes because you have to have a birth education. You have to be educated to understand what you're doing in labor. So it's really important. But if you've already delivered or you've already taken a birth class and you don't need the doula support, then you can always join the membership for $19.97 a month. And you do have access to us, just not the labor bat signal. It's not as intimate. It's $19.97 a month. You can come to the workshops, come to the hangouts. That's another option for you guys. Rhea, do not let them induce you. Hannah, do you recommend induction at 41 weeks? Doctors shares there are risks to the baby if you go past 41 weeks. So what we recommend to our students is if they're waiting for spontaneous labor, baby's doing good, mom's doing good, then we recommend that you maybe consider induction around 41 and 4 to 5 days if you want to be induced, but you do not have to. What's the difference between a midwife and a doula? So a midwife, they, depending on if it's a lay midwife or a nurse midwife, they can actually deliver your baby, where a doula is going to support you throughout your labor with positioning and mindset strategies and just general comfort and compassion. What is one main thing you would want a VBAC mama to know if she's trying for a home birth? I would want you to know that you are no different than everyone else that's having a vaginal delivery and that your body is powerful and capable and to not get in its way. Let it do its thing. One thing I always see is that I think my VBAC mamas, Renee, think that they're different than the other moms who are going for vaginal deliveries, but you're not. You're not any different than my first-time mamas. Trish, so can I still use the labor bat signal being so close to 40 weeks already? Yes. If you're joining my classes and you are over 37 weeks, or if you're joining my classes and you're being induced soon and you're not 37 weeks yet, you can initiate your labor bat signal. So yes, as long as you are buying a class and a member in the membership, whether it's the free trial or a paid membership, as long as you do both. That's a perk for a student who's in the membership. And we have a lot going. Actually, I need to check on one of my girls. Last time I checked, she was 11 centimeters. I'm 11 centimeters. No, 7 centimeters at 11 a.m. I need to check and see how she's doing. I think that Lene was hanging out with her. So exciting. Oh, she has not been back. I hope she delivered. I want to say some of the names because I know some of my mamas on here know who I'm talking, who's in labor right now, but I'm not. First time mom, being pregnant with Hashimoto's disease and hypothyroidism. Anything I should be aware of for labor? Are there any changes that can occur? So Lisa, like I am not, I've had plenty of patients with both, and I have a really good friend who labored with both, but it's not exactly my expertise. I would say that your doctor is going to give you some tips, and I would definitely have a conversation with your doctor about some of their advice, and then I would do some research for yourself as well. Ria, so can you see it on the screen? Are you on Facebook right now? You should see a code, but you can go to labornursemama.com. Let me see if I can pull it up. Here we go. And then you can put in birth queen. If you put in all caps birth queen, you should be able to get the $100 off. And then right away, initiate the labor bat signal. A folded placenta. That's interesting. Is that the term they used? It's very interesting. Hello, how are you? I'm trying to look back and forth. I really wish I could see Instagram's comments. I don't know why everyone else shows up but Instagram, which is really funny because Facebook is showing over here. So weird. Let's make sure I'm not missing any questions. We're doing a birth story tonight with one of my students, Sabrina, and I'm so excited. She had a very fast labor. It traumatized her a little. So I'm interested to have that tonight. Let's see. You're welcome, right? Is it Ria or Raya? It's a really pretty name. Either way, Ria or Raya. Let's see who else is on here. All right, you guys. Well, I hope some of you guys join the birth classes. And if you're over 37 weeks, make sure you initiate your labor bat signal and say hello in the community. We have a pregnancy hangout tonight, 6 p.m. Central Standard Time. 38 and 3. So I want you to do your main birth class first, then purposeful positioning. But you should be able to get through all of them at 38 weeks, especially if you're a first-time mom. So I want you to get through all the classes. You don't need to do the early navigating an early pregnancy section. You could go back and do that if you need to. But I would definitely start with the core chunk. If you want to post in the community, one of us could go in, like say, hey, I'm 38 weeks. What modules should I start with? And I'll go in there and we can give you some tips on that. But you should be able to get done with all of it. No, the birth story is going to be on here at 7:30 p.m. I'm going to do it just like this into all the different areas. Jessica, I was going to ask you if you wanted to share yours, but I figured that was a little mean since baby's only a week old. But maybe next week. We look forward to getting to know you, Ria or Raya, and I'll get to talk to you face to face so I can find out how to say your name. If you just joined the birth classes, inside of our app, it's on an app called circle.so, and I go live usually Tuesdays and Thursday mornings. I go live. It says Morning with Trish, and it says something like, hey, do you want to host with me? But that is not what it means. It's just like a Zoom call, and we all hang out and just chat and talk, and I check up and see how you guys are doing. So I will see you guys on here. We're going to go live on Instagram and in Facebook tonight and share that birth story. So I look forward to seeing you guys tonight. As always, if you have any questions, shoot us a DM. All right. I look forward to meeting all our new students. Have a great night or great day.